that a couple of months ago, I had the opportunity to just go spend a weekend in Newport, Rhode Island. And so didn't really realize how close Newport and Plymouth and Hyannis and all of those places in the Cape area really were to each other. So after we had accomplished what we wanted to accomplish in Providence and in Newport, we said, hey, let's just drive up to Hyannisport and see if we can walk along the beach and see the real Kennedy's beach house. And so we did. And so since then, I've been kind of a little obsessed in kind of rereading a lot of JFK articles and comments and speeches and things like that. And one of the things that I've read recently that really kind of stuck with me, especially as I think about this work, is a quote that or a comment that he made. And he said, change is the law of life. And those who look only to the past or present are certain to miss the future. And so as we talk about the Building Strong Brains Tennessee strategy that is morphing into the Resilient Tennessee Collaborative, I'd like for you to keep that in mind as well. Let's not get stuck to looking to the past. Let's pay attention to what we need to do right here in the present, but let's really keep our eyes on the future. So as you all know, with the original Building Strong Brains Tennessee strategy, the overarching goal for us when I say us, I'm talking the collective us, is to really work to change the culture in Tennessee from this concept of looking at someone and saying, what is wrong with you? So looking at those people or individuals or communities and saying, what's happened to you and how can we wrap supports and services around you in a very intentional way that will help you be successful long term. So would like to spend just a little bit of time talking through what we are envisioning this Resilient Tennessee Collaborative to look like. So when I say we, it is not just
We lost audio.
Background noise, so I think I texted them, they'll unmute Michael again.
Put something in the chat.
here, you're going to see Building Strong Brains Tennessee, Resilient Tennessee Collaborative. And know that over the course of time, the Building Strong Brains Tennessee wording and language is going to go away. So as we think about that, I want to take a second to celebrate and to talk about and kind of reset some of the work that happened that has gotten us to where we are. So let's think about Building Strong Tennessee. So with our inception, there were lots of community things that were happening. There were lots of leaders who were doing work across the state. I really think about the work and talk about the work with 4 cyclones of activity. And I always want to give credit to these groups of folks who were doing this work because they laid the foundation for us. So we have our friends and partners in East Tennessee. Some of whom are in the room with us, who were really doing some work with our friend Becky Haas and the Johnson City Police Department around a handle with care strategy there. In Southeast Tennessee, up on Mont Eagle in Grundy County, there was some really incredible work that was happening with our friend Emily Parton and others. That was a strategy and an effort called Discover Together Grundy. Here in Middle Tennessee, there were folks that were really coming together to create a collective impact model known as ACE Nashville. I know many of you are involved with that and are the inaugural members of that. And then our friends in West Tennessee were really doing some work as well that really resulted in them wanting to replicate the original ACEs survey to see how it was different in Memphis, Shelby County as compared to the original survey. So the work and the mission that really guided everything to this, the words that you see above us are right there on the screen. So what's important with this is to really think about the goals. So as we all started this work together and really started this journey together, there were goals that we laid out. So the first one was that we wanted to increase the potential that every child born in Tennessee has the opportunity to lead a healthy, productive life. We wanted to raise public knowledge about adverse childhood experiences. We wanted to impact public policy in Tennessee to support prevention of ACEs and reduce community conditions that contributed to them or contribute to them. We wanted to support innovative local and state projects and offer fresh thinking. We wanted to seek sustainable funding to ensure that the state maintained a long-term commitment to reducing the impact of adverse childhood experiences. And we really had a goal of embracing open, responsive governance and statewide planning groups. And so I can look through all of these goals, and in some of them I can say we haven't accomplished everything, but check, because we've done a whole lot with that. Real concrete example is I want to give thanks to our friend Julie Rotella, Assistant Commissioner with the Department of Justice, just a couple of days ago, to present information on ACEs and this work to a joint committee of the legislature, and just did a stellar job. So also for us with this work, the visual representation of everything that we were trying to do, we all refer to it as the 4 Ps. And so the 4 Ps are: we wanted to change philosophy and approach, policies and funding, programs and services, and professional practice. And when you look on the images on the outside, and I know you've all seen this before, you're going to see different sectors, you're going to see different departments, you're going to see different community organization focus there, where everyone has a role with the work that we're doing. So to date, we've had a lot of success with this, a lot of national success. We've had the opportunity, and we were invited by Casey Family Programs to spend time with a mayor of New York City's staff to really talk with him about the work that we've been doing in the state. We have had the opportunity to strengthen a relationship with the Palix Foundation, now Alberta Family Wellness Council in Canada, who really did a lot of the initial groundwork with the framework that they built on. We've had the opportunity to present to the National Governors Association. We had the opportunity for Mary Orlando, who was very instrumental in the start of this work, to actually do some contract work with the National Governors Association to help other states. And we've also had the opportunity to provide training to the Trauma Awareness Network of Australia. I would tell you that on there are some smaller wins that are even more significant, in my opinion. And one of the things that I'm the most proud of is that we realized that we had to build awareness, and we had to teach people how to talk about what we're talking about using a common mission, a common language, and common, honestly, slides and images. So in partnership with the Department of Children's Services, others, with some outside national support, we created a training for trainers. And so to date, we have trained over 1,400-ish people to be trainers. And those 1,400 people have trained over 100,000 Tennesseans on this information. So really something to be celebrated with that. So as we started talking about the Building Strong Brains work, we realized that there were some limitations. And so since day one with this work, anytime I've had the opportunity to talk about it, I am always asked 2 questions. So the first question is, how do you know what you're doing is making a difference? And that's tough, but we're continuing to talk about it. The second question was always, or is always, this is fascinating information. What do you want me to do about it? Do you want me to write a check? What do you want me to do? And so that was always a little bit harder to narrow down that concrete action. So as we started reimagining what Building Strong Brains Tennessee needs to be, where we need to grow, how we need to re-message and continue to maintain relevance, the guiding principle of the what next, what is the concrete steps, what are the concrete steps that we need to take to be able to move this work forward in a different kind of way, or a more logical kind of way, was the front and center of the conversation. So I'm going to pass to Melissa to really start to lay the groundwork for you for what's going to look like going forward.
Thank you, Richard. And we appreciate your patience. Like, we have built a strong foundation, kids, because it's been a journey today. So thank you guys out there in virtual land, and thank you guys for being here. We're so excited about what's next. There's potential. You've heard some of this already. You may have heard us talk about Resilient Tennessee Collaborative. You may have heard us, kind of just mention it in passing, but we're so excited to be moving forward, because what has been built already is what we're continuing to use as our strong foundation. So the infrastructure that's in place, there's been a Building Strong Brains coordinating team. So that's been about 8 to 10 people statewide from our child service state departments, and several partners out in the private sector. So like Nurture the Next and Casey Family Programs and Urban Child Institute. I mean, there was another one. So folks like that have been involved since the beginning to help us kind of provide some structure moving along. And then we've also had this public-private sector group that you see here, and that has been a much larger group. Now, most of this work went on before I came into this position, so there's a decent chance you're smarter about this than I am. So just know we are so thankful for the work that has been done in all of these groups. Part of what we're doing now is we are going to take the public-private sector group and just move that into the Resilient Tennessee Collaborative, where it's open to anyone. We're going to work on these affinity groups that you guys signed up for. We know they're imperfect, but we're working on it. My screen's not sharing. That's super sad. Hold, please. So we are going to master the virtual meeting at least by 2030, at least. Can someone help me know if that works? Is that still good? Perfect. All right. So this is what I was talking about in case you didn't see it in our virtual land, but we're moving that public-private sector into the Resilient Tennessee Collaborative space so that we can start to transition the work into more of being a support for the work that everyone is doing statewide in your different lanes. Dr. Dixon, Dr. Mosier, wherever you landed, I don't remember. They have been asking for like affinity groups. Hey, I want to meet with people that do similar work to me, whether it's higher education, youth justice, I work in substance use disorders, whatever that is. People have been asking to know what's going on across the state. So that's part of what Resilient Tennessee Collaborative is hoping to support and build. And we're still going to use all the foundations that we have built over the past few years and incorporate everything that we've learned. And so this is from, you may have heard us call it the core story, the one pager. It's just the basic language that talks about our society. The future prosperity of any society depends on its ability to foster the health and well-being of the next generation. And when Tennessee invests wisely, that's a key word, kids, wisely in children and families, the next generation will pay that back through a lifetime of productivity and responsible citizenship. Like, we can use that one pager if you've never seen it, because we want you to use that language, spread it like just everywhere you see, because that. And you've seen this presentation, so we're not going to harp on it, but you know that when we talk about resiliency, when we talk about how kids are resilient or can build resiliency, we're not asking them to just be that carte blanche, like just go be resilient. Kind of like asking somebody to go stop having diabetes or whatever the case may be. Stop being depressed, please. But we're wanting to help children build that resiliency. But the key is we have to really think about where that fulcrum begins, and we want to help outweigh the negative experience with positive experiences. And unfortunately, it's not just a menu you can choose. If you have this experience, you get this many positives. And so that's part of the work, is continuing to understand and address that and shift that fulcrum to a space where the positive so far outweighs the negative that we are just flooding that child, that family, those caregivers with ways to build resiliency. So Dr. Christina Bethel, some of you may be familiar with her work. She is a pioneer in the positive childhood experiences, or PCEs. And so I love this quote when she talks about the science of ACEs, and resilience shines a light on the importance of the moment by moment relational experiences of children to their healthy brain, body, and socioeconomic or socio-emotional development, not only of our children, but of the whole population. And that science requires a paradigm shift in how we think about child development, about human health, social problems, and the skills and requirements for our own well-being that we can learn. How cool is that? It's not just something you have or you don't have. We can learn the science of resilience. I won't stay on these slides too long because we could stay here and camp for a long, long time because it's just cool stuff. But when we look at positive childhood experiences, part of what she is reported is that 6 to 7, there's 7 total childhood experience or positive childhood experiences. They range from things like feeling like you had, you could talk to your feelings, talk to your family about your feelings. You felt family support during difficult times. There was a presence of at least 2 non-parent adults that you felt like you could trust. Those are some of the examples of the 7 positive childhood experiences. And what they found, it's because I'm touching this cord right here. So sorry. But so what she found was that having 6 to 7 PCEs versus 0 to 2 showed that they, 6 to 7, had 72% lower odds of depression or poor mental health outcomes. Even having 6 to 7 versus 3 to 5, they had 50% lower odds. And so that's just wonderful news, and we can continue to build on that, because when we have PCEs in place, then we can promote those experiences, we can build resiliency, and we can start doing this as a full society and help support. So Richard kind of went over this, and he's going to come back and help transition us into our Resilient Tennessee Collaborative.
Y'all, this technology thing is just making me nervous, Rex, so I apologize. So with the original mission of the Building Strong Brains Tennessee strategy, one of the things that we did as we started reimagining what this work will look like going forward for us is really going through the mission and adapting and changing aspects of it to really more appropriately reflect what we are going to do and what our goals are going to be going forward. So in the original mission, the first sentence was that we are going to work to increase the potential that every child born in Tennessee has the opportunity to lead a healthy, productive life. So that is going to become increase the potential that every child born in Tennessee leads a healthy, productive life. So there are going to be some small word changes, but we think that those words are really important. Goal of raising public knowledge about adverse childhood experiences will become raising public knowledge about childhood adversity, trauma-informed systems, and resilient families and communities. So you will continue to see the next step of the work show up in what our goals are. Original goal was to impact public policy in Tennessee to support prevention of ACEs and to reduce community conditions that contribute to them. That will be very similar and impact public policy in Tennessee to reduce childhood adversity and community conditions contributing to them. So very similar. Original goal was support innovative local and state projects that offer fresh thinking and precise measurement of impact in addressing ACEs and toxic stress in children. That will become support statewide data collection and data sharing to support programs, policies, protocols, policies to reduce childhood adversity, and support trauma-informed systems. Another goal was to seek systemic maintains a long-term commitment to reduce the impact of adverse childhood experiences. You will see that that's going to seek additional dedicated funding and prioritize current funding to ensure support of Building Strong Brains Tennessee, Resilient Tennessee mission. You will also see that in the original goals, there was a lot of language and conversation around responsive governance. And so when this was set up, it's set up very much to have accountability partners and reporting partners of the work that was happening. Some of those entities are not currently functioning, so we just deleted that entire goal. So what we did add that was not in the original is that goal is to provide support, technical assistance, and/or available resources to assist local and regional communities to develop and lead collective impact efforts. So I will stand before you guys every chance I have the opportunity to, and I will always say, I think state government is an incredible partner in positive change in Tennessee. I will also always stand before you and say the magic, the secret sauce, the real work happens in the organizations across the state, because folks who are living, they know the relationships, and quite honestly, they're going to know strengths and opportunities and weaknesses so much more than I will ever know sitting in an office in downtown Nashville and reading just data. So very much, I think that with the folks who are leading this work and with all of your participation, that will be one of the goals of how can we use the resources that we have available to support the work that's in communities. So what we decided to do is we have decided to just throw the doors wide open. So anyone that is interested in building resilience, anyone that's interested in trauma-informed work or building trauma-informed organizations or raising awareness about that, anyone that may not even realize they're interested yet, are welcome to join us. So what we are envisioning is that we are going to get there through a couple of different ways. So what we're going to do is we are going to provide sustained coordination. So those of us that are at the Commission on Children and Youth, our partners in the other state departments, we're going to continue to provide space for folks to come together and then be able to support the coordination of efforts that are happening. We're going to continue to provide leadership. We're going to, again, hold space for conversations. We're going to use any resource or network or knowledge that we have to be able to bring to you all national leaders, national experts, or quite honestly, leaders in communities across Tennessee who are doing some just incredible things and seeing outcomes, because we want to learn from each other to continue to do the best work that we can. We're going to continue to provide the infrastructure, like I said, around the logistics of the meetings and bringing folks together. And then we're going to really focus on communication. How can we continue to share more information? So the way that could potentially look for us is we're going to potentially reimagine what the Building Strong Brains Learning Collaborative looks like. So those of you who have been through the training for each of you, and we really want to think about how, again, we can best maximize that group of folks to be able to lead work in communities. One of the things that I'm really excited about, and as Melissa said, we have heard this from Dr. Dixon and Dr. Moser and others about affinity groups, of hearing people say it would be really nice if we could talk with folks who work in a similar space that I do, because there are nuances, there are language differences, there are priorities, there are trends that are happening that we may not be the best to capture, and really want to create that space for folks to talk with each other and learn from each other. We're going to look at a refresher course for folks who may have gone through the training for trainers a while back, and global pandemic happened in the middle of all of that, and I'm sure that many of you lost sight of that when we were all watching Tiger King and all of that. So I want to have a refresher to make sure that we are all still on the same page. Again, we're going to increase opportunities for folks to engage in the training for trainers session. We're going to target certain sector-specific entities for training. Now, also, one of the things that I would say is that we got a lot of stuff right with this, but there were some shortcomings. And so when I think about the sectors that we have a real opportunity to work with, is I think we have a real opportunity to engage the faith communities in ways that we haven't before, and then also real opportunities to engage the business communities in ways that we haven't before. So those two affinity groups or those two sectors will continue to be a priority. Thank you. Right. And now. Gracious, I have failed technology today. So really what I want you guys to take away and what I want you to think about with the work is we're going to transition from that to I don't know what's happening, to a state-supported effort. Again, very much like I said in my comments a couple of minutes ago, I truly believe that communities have the knowledge. It's just amount of financial resources, it may be technical assistance resources, it may be connection resources, things like that have a different value associated with it. So just want to manage expectations with that, but really see how that's going to be the next step and really lead us towards resilient Tennessee. And this group, Resilient Tennessee Collaborative, will be the vehicle that will help us get there. All right, Melissa, I will pass back to you. Sorry.
We want to say thanks to Kyle from Family and Children's Service for rescuing us from all the places of technology craziness. So like Richard said, we're super excited to be able to kick this off today. It really is just kind of a jump start for us. You're already doing a ton of the work. We just want to help refresh, reset, kind of move into this new space, especially after the past 2.5, 3 years, right? So let's motivate and do that. So we're super excited. If any of you joined us last year, I think, Melissa. So there's another Melissa that's going to join us. So I'm not really talking to myself, but there's another Melissa, Melissa Umer. She did a series of webinars for us last summer, I believe, the summer of 2021 on collective impact. It was 4 webinars. You can still access them on our TCCY YouTube page, and I can send those out after lunch. But she is joining us again today to kind of give us another overview of collective impact to help jumpstart our conversations. And we're going to do several little breakout groups, provided all is right in the world. So stay tuned on that one. But we'll do some breakout conversations and then around collective impact, and then we'll do some breakout around your affinity group choices. And as I was saying a little bit earlier, I don't think I elaborated enough, but we kind of just hit broad targets for affinity groups. We're really okay if these don't meet all the needs. We want to address, move forward, add whatever we need to address the need that's out there. So I've been answering chats. I think I'm answering them as Jerry Moore because I think Jerry's on my computer. So just know one of us is answering you. But, you know, about what about the Knox or the schools that have had training? Well, that is so wonderful. Janet Watkins and the team over at Department of Education have done amazing things. And if we need more groups to help move that forward, I'm in. But we just kind of wanted to broad scope it today and get the conversation started. One group I know that we definitely talked about is how do we engage families and caregivers and children and youth with lived experience. We want to be able to do that for sure. So we're moving forward, but we're super thankful to have Melissa Umer with us today. And I want to be able to share over with her. Melissa, can you hear me? Are you there?
Yes, I can hear you. Can you all hear me? Yes.
I'll show you your face first so they can see you.
You all hear me?
We can. I think. Hang on, you're kind of breaking up for just a minute. Oh, there we go.
Mhm.
All right. I just have to see Melissa's face if you're in there.
Hi there. You all hear me?
We can, but only sort of like, can you hear me now?
Oh, there's a delay.
Oh, that was better.
Is this clear now?
That's better. Or not.
Hi, everyone. I'm going to try to introduce myself and get started here, but I don't know if there's background noise or feedback or delay. Can you all hear me clearly, or seeing the folks on virtual say yes? What about in the room, in the meeting room?
Yes, we can hear you.
Okay, great. Perfect. Well, then I'll go ahead and get started. If you just want to put up slide 2, I did put a picture there, anticipating we might have some technology challenges today. So I'm just so excited to be back with you all. I was thrilled to participate last summer in several webinars, and so really excited to talk more about collective impact with you all today. I hope this is a helpful session for all of you, and welcome your comments and questions. Feel free to use the chat. We'll have some breakout groups later for some smaller group discussions. As those of you who are on the screen in the room, you can see the slides, and hopefully those of you joining virtually can see. I was grateful that Richard gave an intro to Cape Cod, which is where I live. This is a picture of me with my family here. Before the pandemic, I was based in Boston, and we moved down here to the Cape during the pandemic, and my kids are now 4 and 7. We love it here. Pictures here at the beach, when I'm not on Zoom, you can find me at the beach. I worked in social impact consulting with FSG, the firm that kind of coined the term collective impact, for 14 years, and left last year to start doing independent consulting and work with folks like you all. So I've had just the pleasure of working with so many diverse communities across the country. And so a lot of the observations and lessons I'll share today are from that work. I'm not an expert on ACEs or the state of Tennessee, so I'll look to you all to kind of contextualize this learning. And so I welcome your comments and questions as we go through. So moving to the agenda on the next slide, what will we do today? We'll start with just an overview of collective impact. We'll talk a little bit about strategies for changing systems. Richard also spoke about this a little bit in terms of the 4 Ps framework. I think that the systems change strategies will really align well with that. We'll do an activity to check in on how your common agendas, your visions and strategies are coming along, and then we'll have some time in affinity groups before we wrap up. So to start with just defining collective impact, you can go ahead 2 slides. I'm going to move through these fairly quickly since we're running a little bit behind on time and want to leave time for discussions. So really the theory of collective impact is based in complexity science. If you go to the next slide, when FSG, the firm where I used to work, looked across the social sector, there was really a mismatch between the type of problems that folks like you all are trying to solve and the tools that we use. So there's a lot of simple problems out there, something like baking a cake. There's a known recipe, prescribed steps. If you follow it, it's going to be the same over and over again. If you click one more time, there's a lot of complicated problems out there. Sending a rocket to the moon is an example of a complicated problem. You need a lot of experts, probably a lot of meetings. You need to get research, but once you kind of crack it, you can do it again over and over again. A complex problem is, if you click one more time, is one that does not have a prescribed or predictable path. So the parents in the room or the aunts and uncles in the room know that raising a child is an example of a really complex problem. Each situation is going to be different. Kids react to different structures, boundaries, situations. And so you can't think about their nutrition, their intellectual growth or social growth in isolation. You have to be thinking about the whole child. And so what we realized was that in the social sector, we often treat problems as either simple or complicated when they're really complex. So that's what is kind of the basis of the collective impact model. And complex problems, they can't be solved by one person, one organization. They need to have many people kind of looking at the problem from different factors and angles. And there's not going to be just one solution. It's going to be a combination of approaches that all need to be coordinated over the long term. So this is really the basis for collective impact. But what we often see, as you'll see on the next slide, is the field really approaches things in isolated impact. We often see that communities are resource rich, lots of programs, or program rich, and coordination poor, meaning that things are not aligned and kind of all rowing in the same direction. And so how this kind of plays out in the social sector is that there's a lot of competition, there might be duplication. I don't know if there's a delay on my side, but if you can just go forward one more slide. There's duplication of efforts, and really scale is thought about just adding more programs rather than thinking about systems change. And so collective impact, if we go to the next slide, is different in that it is based in complexity science. It understands problems in the systems in which they live, and really says we need to change the way people work together, the way the different organizations, agencies, and entities are aligned to a shared goal or not. So that's on, if we go one more slide. And so it's really coordinated in the efforts that are underway. Great. So on the next slide is just a definition of collective impact, just to pause here for a moment. And so I want to just move this forward from here before we get into all the components. It's a network of community members, organizations, and institutions that advance equity by learning together, aligning, and integrating their actions to achieve population and systems level change. And so what's different here from, this was actually a revised definition of collective impact over the last couple of years as FSG's studied more about just a set, but a full network of organizations and community members, making sure that residents, those that are affected by the challenge you're wishing to solve, are a part of the solution. And really advancing equity, making sure that those who are most disadvantaged, who are furthest behind, are being lifted up. So in your case, when you're thinking about children with ACEs, those who maybe have the most ACEs, or geographies where there's a concentration of families that have experienced ACEs. So what are the components of collective impact? There's, if you go forward 2 slides, please. Melissa, I just saw your message.
Hey, Melissa, your audio is cut in and out really badly. That's the correct English. So we're working on a solution for about 2 seconds.
Yep, take your time. Question to folks who are virtually, is it cutting in and out for folks who are virtual or just those in the room?
Not for virtual.
Okay.
We think we have a solution. So if you're in the room, we're going to ditch the extra TVs. We think that may be causing some trouble. So we love you. Sorry. You're far away. You can also, if you have a computer
Did we just lose everybody in Nashville?
I'm still here. That might be the case. I'm getting text from Melissa saying they're having a lot of difficulty there.
Melissa, would you give us some contact information for you in the chat?
Yes, great idea.
Yeah. Thank you very much.
Well, at least we have you, so we'll get the presentation.
There's my email in there. Oh, it looks like they might be back.
Yeah.
All right, friends. Oh, look, I can like even see you clearly, Melissa. Fun. Okay, kids.
Oh, and you guys are so much more clear too. Wow, the sound is much better now. Yep.
Richard is doing calisthenics with everybody in the room, so give them like 20 seconds to finish their drumming and their stretching, and we'll kick this back in gear. Melissa, I may make you back up a couple of slides.
Sure.
Because we couldn't, it just started breaking up really significantly.
Yeah. I can just do the main point to try to stay on time. I'll just kind of highlight the main point of each. Just go to the slide that I need to start on and I'll take it.
Okay. And you know what, Melissa, like if we're fine on time, if we want to do a reflection like we were just texting instead of actual breakouts to make our life a little less hectic, then we can do that and we'll just make it. We got good people online and in the room and we'll make it work, whatever happens.
Great. Perfect.
Because we'll continue more opportunities for affinity groups. So let me share. All right, everybody here good to go? We prayed about it. We stretched. We drummed. Richard's stress level went down. Okay. I already, look, Dr. Dixon's double joining us. I already have good news from the folks online that said they can hear us and see us much better. So we're going to trust that and rock and roll. Let's see.
You shared the wrong one.
Of course I did. How life goes.
Share that one.
Oh, got it.
There we go.
Okay. Oh, there's a clicker, but who knows where that is? It's back there, I think. Oh, can we start? Can we bake a cake again, Melissa?
Yum, you're making me hungry. Yes. Okay.
Let's do
So
it.
I'll try to make this more concise for the folks who are virtually with me to not bore you. So really, when we look across the social sector, we often look at problems in an incorrect way. So a simple problem is something like baking a cake. As soon as you know the recipe, you can do it over and over again. It's predictable and you can repeat it. The next level, if you click one more time, is complicated. The example here is sending a rocket to the moon. You may need a lot of experts. You have a lot of experiments. Melissa, if you can just hit the mouse, click one more time to show that. Yep, you can leave them all up. That's fine. You need to compile experts. You'll have to experiment. But once you've figured it out, you can repeat it again. It's more predictable. But really, most problems in the social sector are complex. The example here, for those of you who are parents or aunts and uncles, grandparents, know that raising a child is really complex. Once you've raised one child, you've raised one child. You can't predict how it's going to go the next time around, and you really need to think about raising the child as very holistically. You need to think about their emotional health, their intellectual health, etc. And so once you've done it once, you've done it once. And it's very complex, and there's a lot of systems and factors at play here. And so over time, we've seen that a lot of times we're trying to solve problems in the social sector, assuming they're simple or complicated problems when they're really complex. There's a lot of factors at play that need to be taken into account. There's a lot of people, organizations, and agencies that need to be involved. And there's not going to be one silver bullet solution. It's going to be by working on relationships and interactions across a system over the long term. And so when we think about things as simple or complicated instead of complex, what results is isolated impact, which is on the next page. So isolated impact is when we see lots of strong organizations delivering strong programs, But what results is an environment that's resource rich or program rich and coordination poor, and people are competing for resources. And there's duplication of services. There's a visual of this on the next slide. Melissa, can you still hear me? Did I lose you? Yep, there we go. There's a duplication of services whilst gaps still exist. And large scale change is assumed of just scaling up a program, but really ignoring those systems factors at play. And so collective impact is different on the next slide in that it really honors this complexity and thinks about how to solve for problems in the systems of complexity in which they live, and takes into account that you need to align different sectors like government, nonprofit, philanthropy, etc. And all those actors have to agree on a shared goal and start rowing in the same direction like you see here, and really working on those systems and coordination challenges, which we'll see more as we progress in the slides. So on the next slide, just to pause for a moment and share the formal definition of collective impact. This has been actually updated over the past several years to really take into account equity and what we've learned in the first 10 years of collective impact. If you can click once more, Melissa. The definition is that it's a network of community members, organizations, and institutions that advance equity by learning together, aligning, and integrating actions to achieve population and systems change. And so the equity component here is really important because it looks at those individuals that experience the worst outcomes today and tries to improve those so that everyone can achieve better outcomes. So in the cases of your work on ACEs, this might be looking at the geographies with the highest number of ACEs, or individuals or families with the highest number of ACEs, and saying if we can help those who have the biggest disparities in outcomes today, then we know we're going to make a system that's stronger for everyone. So we go to the next slide, please. Go back one. There's really 5 components of the collective impact model. And FSG, the firm where I previously worked, developed these 5 by looking across and saying what really differs strong collaborations from ones that were less strong or not getting results. And so there are 5 elements that I'll go through quickly and then kind of illustrate these to you through some examples. So the first is a common agenda. And this is saying the group has developed a shared vision for change and how it's going to get there. And it's important with a common agenda, we'll talk even more about this later, that you don't rush through it, that everyone has buy-in for what is the problem that you're solving together and how are you going to get there, and that everyone is really invested in that vision and path to success. Shared measurement is the next piece, and that's really getting consensus around how will you measure progress and success of that common agenda. Mutually reinforcing activity. Some of you may remember me saying last summer that this is my least favorite term because it's just so jargony, and it's the most important part of collective impact. This is saying that each of you who are here doing this work are not going to be doing the same thing in collective impact. You're going to be taking on actions that are unique to your agency or organization that contributes to that shared goal. So that's really important to recognize. Continuous communication, this was brought up in the introduction, to make sure that communication is really strong across all levels and that new partnerships, new ideas are happening and people are truly working together. And then lastly, backbone support. This is typically a person or a team that wakes up every day and just thinks about coordination, coordination, coordination. Right? Yeah, I'm sure many of you have been a part of many coalitions and collaborations in the past, that you're all doing this off the side of your desk on top of your really, really hard day jobs to positively impact your communities. And so the backbone support really provides facilitation, coordination, data gathering, ensures that communication is happening and aligns people towards the shared goal. And typically they're more neutral. They're invested in the group's goal, but they don't have any turf or territory to kind of protect in how you're getting to that goal. That's on the how. If we go on the what collective impact is, if we go to the next slide, this is on the how. So we had the 5 elements of collective impact to get started and then said, you know, there's some people who are doing this really well and others are doing it less well. So what is it about how collective impact is happening? So I'm not going to go through these in great detail. Happy to answer questions about them later. But what really is important here is to think about making sure you're engaging community members who are experiencing the problem or have ideas and solutions, in the process and making sure that there is a priority on equity, again, helping those who have the worst outcomes today. And then I would say that you want to focus on both program and system strategies. So we know that a lot of places are program rich. You don't want to forget about those programs. They're critical to communities, and think about what's that connective tissue between the programs. What are the challenges that the organizations who run programs every single day are facing that we want to remove so that those programs are even stronger. Collective impact is all about relationships and trust. So this is saying moving, if you remember from isolated impact, a core characteristic was competition. So saying, how do we remove the sense of competition and get to an even better place of just trust and true partnership? And then lastly, really making sure that collective impact takes into account local context. So I mentioned at the beginning, I've had the pleasure of traveling across the country to do this work, and collective impact looks different in every single community. Even if you look at juvenile justice in one place versus another, it's going to play out very differently because of the local context. And so across your state, thinking about that the regions are even different and discussing that, and that means you can learn from each other and you'll have to continue to customize. I want to next share an example of how this played out in New York in a place called Staten Island. If those of you who are familiar, this is about a decade ago at the beginning of the opioid crisis. And this is an area that's fairly well off. The median income is higher than other boroughs of New York City. High school graduation rates are quite strong. But there was a series of articles that came out about a decade ago that said there was a serious problem on Staten Island with alcohol and drug abuse issues. And people were really surprised. This is something that people had been talking about behind closed doors, but it hadn't been out in the public. And so a number of prominent local foundations and public health advocates said, how can we bring folks together to work on this? And this was one of the very first collective impact models that was studied. And so they looked at the problem, which was that there was a high opioid prescription abuse and poisoning death, and someone was dying every 5 days. And they said, we need to understand why this is. I'm going to just skip to the end of the story here and then back up and tell you how they did it. But by bringing folks together and really looking at the whole system here, in 3 years, they decreased overdose deaths by 32%. And if you can recall, this is at a time at the beginning of our horrific opioid crisis in the United States that rates were increasing in other communities between 2011 and 2014, 2015. So where do they start? On the next slide, you'll see they really made sure they started by bringing together a cross-sector collaboration. They didn't want to create a new program. They knew there was lots of great work already going on to support youth and to work on substance use disorder, but they wanted to better align their efforts. So the Staten Island Foundation kind of took the lead as a neutral convener in the community to bring people together. And they first reached out to those that you would expect, a lot of the public health initiatives, such as the Department of Health and community-based organizations that work on prevention and recovery with substance use. And they said, okay, we need to get some others involved who are, again, more on the prevention and community side. So they got the schools involved and the newspaper who was researching this and writing about it. And they realized they also needed law enforcement. And a lot of the law enforcement agencies weren't working with public health back then. And so they got everyone together. And on the next slide, they said, okay, let's start to map out the system. What are all of the factors that are influencing youth substance use disorder? And they map them out here. You don't really have to understand what's on this picture in detail, but on the left-hand side, these are all the negative factors of affecting substance use disorder. And then we have the positive factors on the right-hand side. And typically a program would say, okay, let's look at one of these or a set of these and create a program to wrap around kids to work on these. And what was different about this effort was that they said we need to work across. We need to make sure we're looking across all these factors to combat this issue at a systems level and community levels. And so that was through many, many conversations, they started to work on things like social norms. They started to work on things like the continuum of care in the community to make sure there were less gaps and no duplication. And they had a very big policy and advocacy effort that was underway. And so those were some of the things that they did, and you can see how it's different again from starting a program. We go to the next slide. So I just wanted to pause here for a moment and see if there's any questions. We've talked about how work is done through cross-sector participation, community engagement, and really learning together. I'm next going to pivot into talking about systems change and something that looks quite similar to the 4 Ps framework that Richard introduced. But before there, let me just see if there's anything that's coming on the chat or any questions in the room.
Jerry, did you see anything in the chat? Anybody questions? I think we might be good, Melissa.
All right, then we'll keep on going here. Okay, so if we go to the next slide. We think of systems change as really shifting the conditions that hold the problem in place, right? So I'm sure many of you have heard the phrase that a system is designed to get certain outcomes. And so this visual is the one that's really similar to your 4 Ps that thinks about, okay, then if we need to shift a system, if we need to shift the things that are holding problems in place, what is that? And so there's really 3 different levels that we talk about this at. So the first is the most explicit and is structural change. So this is policies, which you all are very familiar with, kind of the government rules that influence other people's actions. There's practices, which are more at the organizational level that impact action and really show where you put value and priority. And then there's resources, and this is not just financial resources, but also decision-making, power, people, knowledge. So there's different type of resources in addition to money. And the middle level there is first relationships and connections. So this is really how well connected are people? What's the quality of the relationships and trust and communication that's happening across a system? And then there's power dynamics, how much power, authority, and influence different actors have, including community members and those affected by a problem. And then lastly, at the bottom, you see the most implicit factor, which is mental models. And this is really the deeply held assumptions and beliefs that can influence a system. And so when you're thinking about systems change, you can see how we may start at the top in terms of things that are most explicit and most tangible, and then slowly work our way down. And collective impact is really a model that's designed to tap into those lower 2 levels by saying, how can we shift power and deepen connections and relationships and change mental models by getting people together, having continuous communication, and kind of forging new ideas and relationships that aren't otherwise happening when folks are implementing their models in more isolation. And so I want to share another example here of some work that I did in Omaha on juvenile justice. And so if we go to the next slide, this effort had a lot of different facets related to the juvenile justice system, but one specific area looked at how to bring together the education system and the juvenile justice system, knowing that obviously when we're talking about kids, they spend most of their time in school. And so there's 3 kind of areas of overlap that we're feeding into the juvenile justice system when you bring these 2 systems together. So absenteeism, school-based arrests, and school re-entry when folks were coming back from placements outside of their schools due to justice system involvement. And so this was a really political, really difficult conversation to have. I'm going to tell you more about the school-based arrests conversation. And so what we did was get together, probation officers, school administrators, social workers, prevention-based nonprofits that were working in schools to really have a conversation to say, how can we reduce the number of school-based arrests that were happening in the system, in the schools. And these stakeholders just usually never worked together, right? It was by no poor intention of folks. Everyone did care about the kids. And we had to unite them behind that goal of saying, we do all together want to work to reduce the number of kids getting arrested and into the juvenile justice system at school. And so we worked with them to really map out the system, start to understand the data, what were some of the arrests, who were getting arrested, so that they could really come to an agreement together of what they could do about this problem. So if we go to the next slide, they really worked on 3 things. So the first was a pilot project called the School Justice Partnership. So this was designed by these stakeholders in the room that said, we need our school resource officers, administrators, and probation officers to have better communication and coordination about our highest risk students. So these were students that had had an arrest, who had had contact with the juvenile justice system, to say, let's work our best together to make sure that those kids don't have a second offense once they're back in school. When they looked at the data, they knew that was highly likely. And they said, rather than responding with justice system involvement, let's do proactive check-ins about those kids on a weekly basis to say, how do we put more protective factors around them? And that was really powerful. This took time. The backbone of the effort was the one kind of coordinating these meetings and facilitating them from a neutral perspective. And it took time. This didn't take a lot of financial resources, but it did take time to reorient around these kids. And it had great success. The number of school-based arrests in the schools where this pilot project was administered in the first year, it went down 50%. So just by increasing communication, it really helped. And so in addition to that kind of high touch pilot for the highest risk students, there were two other things that they did to try to change mental models and change practice in the community as a whole. So the first was they introduced community-wide trainings for police officers on the teenage brain to just reorient them to how the teenage brain works and how they can better police with that in mind. And they also talked about the legal consequences of the juvenile justice involvement and really tried to help teach retrain those officers on how to use more discretion of when they went to arrest versus a different school discipline approach. And this really started from the top down with the deputy chief of police, just reiterating how to use discretion and setting just a different tone from the top once he started looking at this data and really working with other stakeholders. And then the last piece was a policy change to nationally certify all their school resource officers. This was kind of happening in the off chance of when people had time to get certified and all of that, and they really felt like it was important to retrain, ensure training for every single officer, that being in a school is really different from being in community, and what does that mean? And they committed to making sure that 100% of their officers were trained. So those were just three things that resulted. Again, not super complex here, but had a big impact on how police showed up at school, how students interacted, and just the number of students who were getting arrested at school. We go to the next slide. I'm going to wrap up here with a deep dive on the common agenda. The common agenda is really a critical component of collective impact to make sure that everyone's aligned on what this is all about and how it's going to be different from other partnership efforts. And so what is it? A common agenda is a goal. It's really making sure that we have a goal for where we're all headed together. And that needs to be grounded in what problem are we solving, right? So you saw with that education example, the juvenile justice and education system example, that we really had to say we started from this very big problem of the intersection of education and juvenile justice. And then we had to say, okay, what are the sub problems there? And you saw the three. And then we said, okay, let's start by really working on school-based arrests. And then we had to understand that data even more. Which schools have the highest arrests? Which kids are getting arrested and for what? So making sure that everyone's looking at data and understanding the problem and what problem we're solving from the same perspective. Really, the reason why the common agenda is so critically important is it makes sure that everyone has buy-in and ownership for what's happening and how it's different from other things that you may have been a part of. And it's a way that usually this can be reflected on kind of a one-page document so that participants in the coalition or collaborative can share it with others if they want to get involved or just communicate what this work is all about. This should just some myths. It should not be top down. It should not just be about getting a plan together and something on paper. This usually takes about 6 months to put together to do right because you're convening folks to talk about it and make sure that you're getting that buy-in and building relationships as you do it. So the process of developing a common agenda is as important as the result of kind of the one pager that you get at the end. Where we see a lot of collective impact efforts kind of lose steam is when people are brought together, they're really excited, and then just a small group puts this together and there's no buy-in for it from the wider coalition, and then people don't participate as actively. So I'm going to walk through each of the components of the common agenda next. So on the next slide, these are the 5 pieces that I'll be walking you through. So next slide, please. So guiding principles, it's really important to make sure that you kind of set the container for your group about how you want to work together. We usually call these kind of like the rules of engagement to make sure that everyone is coming at this from the same kind of perspective. And if someone's violating one of these in the way that they're showing up, you have something that you can point to. So it's and these can also help describe how this effort might be different from past efforts. So you might talk about things that you're working on a systems change approach. You're not working on programs, that you want to be asset based, that you want to empower people and families. This is where if you have a principle about equity and making sure that you're working on solutions for those that are disproportionately affected today. You might state here if there's certain populations that you're targeting. So just things that are important about how you want to show up and who you might be serving could live here. It can kind of serve as a catch-all for things that might not be in the goal. So the next piece on the next slide, defining the problem. So I've been talking a lot about how we want to define the problem in data and then contextualizing that in the lived experience of people who are on the coalition. So really you want to set boundaries on things, because one of the biggest problems that I see in strategic planning in general, not just for collective impact, but organizational as well, is you're trying to boil the ocean, right? And that makes people really frustrated because you're not setting some boundaries. And so this is really tricky because you want to balance thinking about the complexity of the whole system while setting some boundaries so that you can work on it very tactically. So if you click through, so you can see the example here. Sorry about that. Should be a couple clicks maybe. This is an example of if you're thinking about folks with diabetes, you might say, you know, where do we want to focus, upstream or downstream? Do we want to be on the right-hand side of those who have uncontrolled diabetes? They might be experiencing really bad outcomes right now, but it's a smaller population, versus moving more upstream and saying, let's work more in prevention and thinking about those who are at risk for diabetes and changing lifestyle in terms of the foods they eat and how active they are. So this might be a choice that a collective impact initiative is making about where they want to focus on how upstream or downstream that you want to be. Go to the next slide. So then after you understand the problem, it's then important to set a goal, right? And be really, really specific about that. So it needs to be measurable while also being really audacious and inspiring to the group. And you want to make sure that you're considering equity, as I mentioned before, if there's a certain population or group that you want to focus on. If you click one more time, there should be an example here as well. Can you click one more time? There should be an example here. Here we go. So this is the diabetes example from the previous page. After they thought about the problem, the goal that they formed was to reduce the number of new cases of type 2 diabetes in 5 years, such that we cause a 10% reduction in the prevalence of diabetes by 2030. And so they have a bit more about who they're going to target and in what areas. But this is really important to think about the time frame and the reduction and kind of where, especially when we're talking about health, between prevention versus treatment, you might want to focus. The next component, if we go to the next slide, is your framework for change. And so this is just a way of saying what you're going to do, right? So you'll need to make some choices on the types of strategies or areas that you want to focus on. And think about, okay, if we're going to put together some work groups or committees to advance this, what's most important to us? So if you click again, you'll see an example here carrying it through. So, you know, in this example about diabetes, they had kind of a communication strategy. They wanted to do a prevention on screening and testing and education, and then thinking about more in the medical framework to change practitioners' kind of practices and approaches and processes with individuals and families. And so this is just one way of thinking about it. In the juvenile justice group, we had, the education juvenile justice group. We also had a prevention group. We had a group focused on families and their experience with the system. So as you're kind of looking at the data and setting your goal, saying what's the way to really organize the work so it becomes more manageable. And it might be that you say there's 5 committees that you want to start or working groups from the beginning, but you can't get them all up and running. So then you prioritize 1 or 2 to get started with, kind of the critical areas that you want to start with. And then finally, on the next slide, plan for learning. So it's really important that you adapt as you go. So you'll want to have ways to be capturing data on progress. So this might just be on milestones. It doesn't necessarily have to be getting right to population level change at the get-go, but saying if you're thinking about changing practices of people, how are you getting data on that? How are you getting feedback from the folks in your coalition about how they're changing what they're doing based on what they're learning here? So for example, I'm working with another opioid use disorder coalition right now in Ohio, and they did a lot of community engagement over the spring. And right now they're changing the harm reduction services that they offer as a result of that feedback. And so that's something that we're not necessarily getting to a reduction in overdoses overnight, but saying acting on feedback that folks are sharing. And so if you click once more, there should be another example here as well. And so really thinking about, for the diabetes examples, that behavior element is how are you changing behavior of doctors who are seeing patients? How are you changing behavior of patients themselves? And then you're eventually going to get to a reduction in risk factors and reduction in diabetes. But it's really important to be thinking about how can you capture feedback and progress on the behaviors, the policies, the practices, because that's really the black box, if you will, of how change happens. And we normally skip that step. We think about programs and trying to measure the outcomes from programs, but we're missing kind of all that stuff in the system that we want to see change, like how doctors approach things, for example, how folks are thinking about things outside of the doctor's office. So I think we're at the end of our section here. Just a few last comments about the common agenda. I know it seems really simple as we lay it out this way. It is a difficult process. You're doing something that's kind of countercultural to how the social sector has worked for a long time. People are used to having their own siloed perspectives, thinking about their issue, their organization. There is a culture of just distrust and competition, or thinking about things in competing ways. And working in this way is different, and there might not be incentive either financially or through relationships to do so. So thinking about, as you're getting people around a table to come up with this, kind of making sure the benefit is clear. The way I often think about this is it's a way for you to set goals of things when you're running a program. What's the stuff that gets in the way of you doing your job every single day? That's what you want on your common agenda. That's the goal you want to have, that your program or even your position, there's no way you can tackle that. It's too big. And there's lots of those things out there in the ecosystem. And so that can be kind of the catalyst to getting people together. So we were going to have a breakout, but I think we're going to pause here and just give you a few moments to reflect. There was, I believe, in the meeting invite, a reflection worksheet that was shared. I'll put the link in the chat for where we had it for the breakout so you can see. But we wanted to just take a few moments. If you go to the next slide, Melissa, the questions will be there. And think about, like, where are you now? Think about a coalition or a collaborative you've been working in. Where are you now with your common agenda creation? Would you say you have these different components? Do you just have a goal, for instance? Have you not been thinking about the problem? And to share, what have been some successes that you've had in getting agreement and getting on what you just heard today in these different examples? We'd love to hear from folks. I'll drop the worksheet in the chat in case that's helpful for you to see as a visual. But really would just love to hear from you all about what are you taking away from this? What are some reflections you have on your work to date? And what are some kind of hopes you have for next steps? So maybe give like a couple minutes for just reflection and then we can open it up, Melissa.
Yeah, sounds to me.
Oh, we can't hear you, Melissa.
Can you hear me now?
Yes.
Okay. Okay, I am just trying to get the right screen up because it's split screen and that's a little bit more than my pay grade. But if you want to take a few minutes to think through those questions, that's your first worksheet with all the pretty icons on it. And then we'll come back and have a conversation together.
So people at the table start talking with themselves.
They can.
I don't get it.
So Richard is asking for clarity. Because I'm not good at that. You can talk at your tables if you want, because you're in your affinity groups, or you can not talk at your table. Our virtual folks are not going into breakout rooms because we feel like that's pushing the edge of technology issues, and that might send them to my own. Come back in like 2 or 3 minutes. I put it in the chat.
Oh, well, the people here don't know. They couldn't see it. That's not the traffic light.
I think it's just, it just is too much, you know? I don't understand, A, why that's gonna happen. B, why isn't it showing? The deal is, it's like, it's just like. Okay. Melissa, can you hear me?
Yes, I can.
I can't hear you, unfortunately. What happened here? Will you try again?
Can you hear me?
Yes.
Okay, I'm back.
Okay, I think we've got it. Okay, so they're rocking and rolling here a little bit. Virtual people, I'm confident, are doing your part and just kind of reflecting. You tell me when you're ready to bring folks back.
Yeah, why don't we give like 5 more minutes? You can let me know on the energy in the room too. I know I'm sure it's probably more vibrant there in terms of talking to folks, but I don't want to make the virtual folks hang out too long on their own.
Yes.
Just
No, I'd say let's do it. It is 2:36, so maybe like 2:40 Central
Yeah.
Time.
perfect.
We'll
Yep.
come back together. It's good.
Good.
Thank you so much for being flexible with us.
Of course, yeah. We'll figure this out at some point.
Okay.
Joyce is raising her hand.
Joyce.
Let me see. Nope, maybe she didn't mean to. I'm just gonna go grab some water, Melissa, and I'll be right back.
Same.
I mean, I'm not being up, some of them been doing the work now. Why?
Dr. Dixon said on that, we go, on that one call.
That's right, exactly. We need a good snapshot of what all happening, and I know that's what you're trying to.
Yes.
I hope you swear you don't like the impact work, but that's not necessarily built on, building strong brains or accents, but.
Hey, virtual friends, we're coming back together in about 30 seconds. All right, Melissa, are you there?
Yep, I'm here.
Let me gather folks here in the room.
Yeah, let's start with comments from the room so then we can get their attention.
All right, friends. Thank you for your healthy discussions. They are rocking up here in the room. All right. I will pass off to Melissa to kind of guide us, and then I can help provide the conversation here in the room so everyone can hear.
Great. Can everyone hear me? Yeah, great. Okay, so would love to start with folks in the room, just so we know we have your attention, and then we'll turn to some of the folks in the virtual room. So would love you to share one of two things. One, either just a lesson you've learned in this work about something that might be helpful for others to hear about how you've had progress or success. So kind of a piece of advice or a lesson you'd like to share, or a question you have, or how you need help to move forward. So you can kind of choose if you want to reflect and share a lesson, or you have a question or a challenge or a suggestion of how you need more support with this work. So either of the two, would love to hear from folks.
Ms. Barber.
Pulling your groups together for your collaboration. How do you get the right at the table so that everyone, all sections, are truly representative? of the rest of the problem?
It's
So,
hard,
Melissa,
it's hard
did
to
you
hear,
hear that?
Melissa. No, if you
Yeah.
could repeat the question.
So that was from our community mental health table. The question was, how do you get the right people at the table? How do you get these cross-sector people to be interested in joining the work that you're doing? Because everybody has their own agenda, right?
Yeah, great question. So on the very practical side, what I'd share is the way I've done it is normally you have a group of people who are the champions for the work, right? So you might have 4 or 5 people who are really close to the work. They're champions for taking a cross-sector approach, and you get them in a room together and you say, who else do you want to be here? To put together kind of your leadership team. And so by kind of brainstorming, and as a facilitator, what I've done before, like when we had that juvenile justice group together, we said, who do we need who's a part of the Latino community? Who do we need that's a part of the Black community? Who works in schools? Who works in community-based prevention? What about law enforcement? And so if you have some buckets and then brainstorm at 2 levels. First, who are the major organizations that are super influential and you need them at the table? And then secondly, who are individuals? So either within those organizations, who's the right person to come to the table because you think that they'll be collaborative and open-minded, or are there other individuals who you might not have thought because of through the organization kind of brainstorming, but you know they're critical leaders in the community and they care about this issue. So that's kind of on the practical side. And then more on your question about how to get buy-in. I mean, typically I found it has to be kind of a combination of then sending those champions out to talk to folks with a 2-pronged approach. One is just sharing data and facts about the problem, about why it's getting worse, about the disparities in the data for some people, and really showing how they fit in, even though they may not see themselves kind of in the problem directly, showing them how they fit into that problem and the potential solution. I think the other piece, which I mentioned earlier, I'll just reiterate, is really playing into the fact that most people I've come across who work in the social sector, they face challenges every single day doing their job well and saying, you know, what's getting in your way? What are the policies? What are the poor relationships? What are the financial misincentives or disincentives? And really calling out some of those systems challenges that most people who are working just to make others' lives better will say, like, yes, those are the things that get in the way every day. And I don't have the power, authority, money, or time to solve those. I need to do it in partnership with others. Does that help answer the question?
Thank you. I see some heads shaking yes. Other thoughts? What about, Melissa, can we ask if anyone online or has succeeded at CREEK? Because I know we've got some good collective impact work going on in some pockets across the state. And so is there anyone who would like to share an example? Coming at you. Okay, give us 2 seconds, Dana.
Richard Taylor with D-Transact. We were part of a coalition and here.
The last in Northwest Tennessee, and part of the collective impact that we've been doing here, the Northwest Corner, it's a brand program where we're doing if they're less than 9.
Okay, I'm going to let you go ahead and we'll work that other part out.
Hi, I'm Richard Taylor with D-Transact. We work with a coalition in the Upper Cumberland region of the city, which is 14 counties around Cookville, to come together to go after a poverty transformation grant. And so we put together a coalition to go after that grant, and we were successful in bringing all the stakeholders together. Poverty alleviation, which was a 2-generation poverty alleviation. So we had to bring groups that work with children and youth. So we brought the school systems, we brought the university, we got the health system, got the Economic Development Group, the Chambers of Commerce, we've got the local foundation, the local Community Action Agency, which is the Health and Human Resource Agency. And so they were the lead agency, was the Human Resource Agency, and so they brought all the other stakeholders together. But the success was we were one of 80 coalitions in the state that were applying for 6 grants. And we won. We won one of the 6 grants because we came together and used the collective impact principles to put together and together this little brochure that was a result of what we did. So it was an exciting event, and it can happen. It's not easy. It took a while to put it together. So I don't want to.
So I'm going to try to summarize that wonderful knowledge in a way that's not going to disrespect any of the good things you just said. So Richard Taylor, tell me again your org.
E-Transact.
E-Transact? Huh. Oh, X. Gotcha. And so they were a coalition that came together to pursue one of 6 poverty elimination grants. And we're successful in out of 80 organizations, coalitions that applied, they were one of 6, and they used the collective impact approach and were able to get one of those grants. He's in Upper Cumberland, and Melissa, that's kind of between middle and east on the north side of the state. We can draw you a map. It's a little.
I would love to hear from Richard about if he had to just expand one more comment about what would he say was the #1 thing that was different about how they applied for that.
Hey, will you come answer that here so that they hear your voice? Melissa, will you ask your question one more time?
Yes. #1 thing that was different when you use the collective impact approach from when you've maybe applied for funding in the past or tried to collaborate in the past.
Well, a couple of things that you mentioned. One was make sure everyone had an agreement on the goals that we wanted to achieve, and then have an agreement on the model, the model that we were going to use to eliminate poverty. And so we had to agree on the critical success factors that were part of that framework for change, I think you called it, and reach agreement on that. So that helped bring everybody together because, these groups are not used to working together. And so we had to have a common agenda, a common goal, and a common framework that we agreed upon.
Great.
Share data.
Oh, yeah. That's the part E-Transact does, is we're a data company. And so we help put together the strategy on how we are going to collect the data to measure the progress on the project, and then how to be able to share data between multiple systems. Because as you know, any given community, you're going to have multiple systems that don't talk to each other. And so you're going to have to solve that problem. And that's part of what we did.
Thank you. What's really cool is Richard signed up to be part of our business affinity group, and I love that because that's the sector we're really targeting. So. Oh, that's right. If you have an example, would you come here to me so that our virtual folks see your beautiful face and hear your words and not mine? He said he has a face made for radio. You introduce yourself. Sure. I'm going to get out of your way. You have to stand right there.
I'm Stan Harville from Morristown, Tennessee. I'm with HCXL. It's Hamlin County Foundation for Educational Excellence and Achievement. See why we go by HCXL. Much like Richard, we got hooked up with Strong ACC, the Strong Accountable Care Network in Northeast Tennessee. They found us because of some advisory council work that we have done through a program we have called Ready by 6. We have brought together all of the many nonprofits, Tennessee Voices, Tennessee Institute of Public Health, a lot of others, to attack the problem of children being ready to succeed in school when they get there. But that's where all that conversation came from. But because of the council work that we had done, the advisory council work that we had done, they brought us in and had us kind of work through that with them.
Awesome. Thank you. I think Sean might have been trying to get your face on there.
I wanted your face that was made for TV on here. So
I think if we hit escape, it maybe just stop sharing. Okay, all right, Melissa. What about online? I'd love to hear any. Oh, everybody's so quiet. See you out there. Okay. We can move to what is next. I do love hearing from all the various different participants, especially here in the room from sectors that we haven't always participated with. I did see some chat stuff, Melissa. I don't know if you can see the chat.
I don't see any new chats from when I sent the worksheets out, so I don't know if they're just coming into you.
So let's see, Miss Umer, do you or FSE have available supplemental resources that more thoroughly guide process of collective impact? There's evident utility in this strategy, and I would like to learn more.
Yes, so the Collective Impact Forum is an initiative of FSG that was set up to, so FSG does consulting, right? So they do paid consulting. And so they wanted to say, how can we support all the great initiatives that are out there who don't have the financial resources or the time to bring in consultants to help? And so when you go to the Collective Impact Forum's website, there's so many resources from the Collective Impact Forum, from partners, from folks doing the work. So you can almost search by any topic and find what you're looking for. I had put my email in the chat for those of you who are in the room. Feel free to get in touch with me if there's something specific you're looking for. I'm happy to direct you. I know there's like so many resources on the Collective Impact Forum. It can also be quite overwhelming. So if there's something specific that you're looking for, just drop me a note and I'm happy to direct you since I'm familiar with a lot of the resources. But there's a lot of great guides there on how to embed equity, how to think about your work groups, specifics on how to measure and evaluate collective impact, how to get started. So there's tons and tons of resources and lots of great, if you also don't like to sit and read reports, there's podcasts they've come out with, there's webinars. So there's something for everyone in terms of learning styles and topics.
Thank you. Others? I think we're pretty quiet here in a real person space, in-person space. We're all real people.
Great. And something, so we had planned for the affinity groups. So something just to keep your eyes open. Melissa and I will talk about how we can get some of your input offline. So perhaps we'll send out a short survey or just send out an email. We want to know, based on the affinity groups, now that you've got reintroduced to collective impact, how what type of additional support you might want moving forward, thinking about sector by sector as well. This is a cross-sector approach, but there's also great value in sharing and learning with your peers who are from a similar sector, but maybe a different geography, for example. So just stay tuned for more, and as well as more questions if they come up for you outside of the session. I'm always available, so feel free to drop me a note and I'm happy to answer your question over email or connect you to betters with someone else who can, or share some resources.
Yes, and I think our affinity groups are where we're going to hone in our own, like we don't have to necessarily have Melissa with us to really hone in on those and start supporting those. So we'll do that work here in our state. And since we didn't really get to break out into those groups today, know that that's coming. And a lot of you asked about participating in more than one. You're like, look, I work in youth justice. I want to be in that group and I want to be in the adolescent and youth group. Well, that's awesome. You can be in every group, because most likely they won't all meet at the same time. However, when we do our large collaborative meetings, you might have to choose your favorite. But we'll work that. Melissa, did you want to, is there other, you want to go through the rest of your presentation?
I just had one last slide. You don't have to put it up. I can just to it. I can speak to it and save you a moment. So the last thing I just wanted to comment on was just based on my experience facilitating groups here of just some pitfalls to avoid with collective impact. I think I've mentioned several of them throughout the presentation, but number one is don't rush. Don't rush through the process. The process is as valuable or sometimes more valuable than some of the outcomes. So take time, engage the community, build trust along the way. back to the question about, how do you get people to the table? Make sure you don't fall into the pitfall of just having kind of the usual suspects around the table. If there is some differing viewpoints, that's good. You want people who maybe look at the problem from different perspectives or with different mindsets so that you can come to kind of a common ground. On the backbone, we didn't get to talk a lot about backbone. There was a webinar I did last year just on the backbones if you want to learn more. So I'd say start there. But we see a lot of communities fail out of the gates because someone self-declares as backbone. They kind of raise their hand and say, I'm going to do this. The backbone is really important that that organization and the people working within it are neutral. I'd say, one of the best examples I always share is, since it was just mentioned, is the Strong ACC, since I worked with them several years ago, that even though Ballad Health, which is a large health system, you might think they weren't seen as neutral. We did an evaluation. People said they were concerned about the neutrality, but Ballad really mitigated that concern and had people who really acted neutral and in the best interest of the community who are running that. So you always have to keep kind of that perception in mind and be mitigating that the backbone has to be advancing the group's goals, not the organization who maybe pays them every single day. So keep that in mind. Collective impact should mean doing things differently. So it should feel different. It shouldn't feel like the normal course of business. And so that might mean it's a little uncomfortable or there's challenges along the way. But just like anything that you're kind of growing in and learning in, it's got to feel a little bit different. And then the last thing I'll say is make sure you're celebrating quick wins along the way. Tying back to the kind of the first lesson, which is this takes time. You have to build trust. When little things happen along the way, kind of small wins of people collaborating and communicating better together, big wins like getting a grant when you were working on something together, a new partnership, just better outcomes for a small population of people in your community. Make sure you celebrate those because people can get really bogged down with the process of collective impact and you're almost so in the details you might not see some of those wins. So celebrate them as much as you can to keep the momentum going. So happy to continue to be a resource. Just thank you all for the time today and getting to share my stories of collective impact. I hope you all at least took away a couple of little nuggets to apply to your work. And I look forward to seeing where things go next.
Thank you, Melissa. We will get to continue to do a little work with Melissa in regards to this effort today and moving forward. Like she said, since we didn't break out, we may send a survey out, and I probably will harass you to fill it out about affinity groups to look at some of these questions that are specific for your group and just get a little bit more information. Any questions? Let me look in the chat. Jerry, anything I need to see in here? Oh, Corey sent the worksheet back out. Thank you, Corey. All right. I think we're good. Melissa, thank you for your patience and your flexibility today.
Of course. Good luck with the rest of your meeting. Take care, everyone.
I think Richard may want to say thank you.
Hey, thanks, Melissa. We appreciate you as always, and we will be in touch with you to keep on more. So thank you.
Sounds good. Thank you, Richard.
You're welcome. One of the things that I do want to say about the affinity groups is that of all of the things that we've had to adjust today, this is the one that makes me. We want you to know is that within the next week or so, we're going to start to send out some information to be able for you all to join some virtual affinity groups so that we can go ahead and get this work started. As Melissa said, she will likely send out a survey to get some information. We think it's incredibly important to build on this momentum and to, again, go ahead and create that space so that we can have some routine conversation and start to do this work with the group. So know that it's not a no, it's not going to happen. It's just that we're going to get it.
So we're going to take a breather. Let's take like 90 seconds so Julie can get a breather. And I'm really excited to have Julie Rotella with the Department of Children's Services. She's going to give us an overview of the exciting work that innovation grants have been doing. Kind of just a big picture of them. Very big picture. So let's take like 90 seconds, virtual friends. Breathe, do your calisthenics. Richard can lead some in the corner over here if anyone needs that. And we'll be back in just a few.
2 seconds.
All right, friends, we're gonna gather ourselves back. Thank you again for your patience and your participation. You're still here. That's a bonus. I would be excited. Richard's in here, so I'm just gonna. We're super excited to have partnership with Children's Services in our work in the Building Strong Brains world. And Julie Rotella is the Assistant Commissioner of Administration for DCS, and she is the guru of all things Building Strong Brains at DCS. So she's going to kind of give us just an overview of the innovation grants that you have to say.
Yeah, it was really, I'm really going to give just more of an update of the grants. There's 26 grants, so a lot of just innovative and outstanding work that's going on. But I'm not going to get into each of those, just to kind of give you the update that in fiscal year 22, we had 26 grants. We started out with 20, they were renewed. Most of those have been in operation for 3 to 5 years. And then we had in 2022, we also had an announcement of funds looking for new grants, and the selection committee awarded 6 new grants based on that AOF for FY23, and a total amount of over $1.9 million was awarded for those 26 grants. And in FY23, the decision was made to just renew all of those 26 grants for 1 more year. This will be the last year, FY23, that we renew grants. In FY24, we will be doing an announcement of funds, and the steering committee actually will be working to kind of look at what will those parameters be for those new grants. But we really want to give an opportunity for some new innovation, some new projects out there, maybe touching on new areas or parts of the state communities that maybe don't have some of this work that's going on to build strong brains and trauma-informed, trauma-responsive, really looking at how we move to more of a trauma-responsive platform, and really promoting resiliency within our children, our youth, our families, our communities, as Richard said earlier. So most likely you'll see an announcement coming out February for those funds, if anybody's interested in pursuing a project. And if you've already received it, we're not saying that anybody who's currently receiving a grant would not be considered. It's just that we'll be asking everyone to begin the whole process over in the selection. So I want to turn it, so instead of going into 26 grants, we have Emily Norris here who will focus on their grant and the work that they've been doing. Emily Norris is the Senior Director for Child Welfare and Community-Based Services with Family and Children's Services. And I want to make sure I get the grant title correct. She's here to talk about ACES Innovation Project, Fostering Resilient Communities, Developing a Neighborhood Charging Station in North Nashville. So, Emily?
That way. Oh, I'm going to get her presentation done. Get your presentation going.
Hi, everyone. I'm Emily Norris.
You have to
Oh,
come.
okay, I thought you should know this. Working on IT all day today. So I'm Emily Norris. I'm the Senior Director for Child Welfare and Community-Based Services here at Family and Children's Service. In that role, I work with our BSC Innovation Grant, as well as our Davidson County Resident Caregiver Program, and our community school work. We are so grateful to partner with TCCY, BSP, and of course the Department of Children's Service for this funding that we have received for 4 years. We're in our 5th year of funding now, which is super exciting.
Down this road.
So thank you for bearing with me with my mask. I have a little one, and he just became eligible for vaccine, so she got her first 2, but I'm waiting for her next shot. So still very careful. But we are excited that you all are here today. being here. It's exciting that we get to have an in-person event. When we built this building, we moved in just under a year before COVID, and then everything sort of shut down. And we're excited that we get to have more opportunities for people to use the facility, and we are grateful for people to be here. So, am I? No.
You're good.
Okay.
You're good.
So as I said, we are, and also, I want to introduce Chandel further, who is right over here as a participant today. She is actually the coordinator for this project. So she runs the grant, and she actually started with our project during our first year as a partner, and has now taken over the coordinator position this past year and is doing a fantastic job. But I didn't want to make her do all of this for the last 5 years, as she began this year in her official role. So thank you, Chandel, and I'm glad that you are here. We're grateful to have her. We are very grateful to the Department of Children's Service for making this project possible. We actually applied for this grant before we had moved into this space. So Family and Children's Service has been in Nashville for 78 years. We were located for 50 years over at 23rd and Elliston area. And about 5 or 6 years ago now, we sold our building over there because we had outgrown it, and we rented space in North Nashville and started building this building, which was already here as a warehouse. And we wanted to establish our roots in North Nashville. So part of the reason that we wanted this funding was that we wanted to become good neighbors. We wanted to move in, not just move in, but move in and become part of the community and help to strengthen the resilience that's already happening in the North Nashville area. As well as at around the same time, a lot of statistics came out around 37208. You all might have remembered that they have the highest incarceration rate in the country. If you saw that article, and so that's part of also why we chose this community, was we were moving in. We are actually in the 37209 zip code, but we are right beside the 08 zip code, right beside our partners at Pearl Home, where we work very, very closely. So we established several goals for this project. We wanted to become a charging station in the North Nashville community. We wanted to create a hub where people could come to access resources as well as build resiliency, process trauma, and work on the connection between ACEs and resilience and protective factors, and sort of be that space for all of those things to come together. So in the first year, we did a lot of assessment and building. So that started in 2018. That started before we actually moved in, but we're still in the process of building. And what we did was we actually did quite a lot of different types of activities that year. We hosted some community conversations in the area where we asked some specific questions of people, wanting to know what were some of the challenges in the neighborhood, and also what were some of the strengths in the neighborhood. So with that, we created a needs assessment. We began our work with a task force, and so we developed partnerships, local partnerships with community members, neighbors, faith communities, schools, business partners, government partners, and really put together a task force that started meeting quarterly. Then we moved into our building, which was really exciting. We had hired our coordinator who was different than Chandel, a different coordinator who still works here at Family and Children's Service in a different role, started receiving a lot of training. She became a VSB trainer. We started providing VSB trainings. We collaborated with a lot of different partners. There was a partner here that was already doing work in North Nashville called My Campus that does therapeutic interventions with kids and Cheatham Place apartments. We worked very closely with them, put on an art show, and started doing some a lot of mentoring work with Pearl-Cohn High School. So part of our project is that we collaborate with our own internal partners at the agency. So Family and Children's Service has a community schools program. We used to have 4 schools. We have just expanded to 34 schools with the help of the state and Metro Nashville Public Schools. And several of those schools are in the North Nashville area. But at the time, one of our principal partners there, and still is Pearl-Cohn High School. So we started doing a lot of work with them around mentoring their students. We started a character education group as well as trauma processing and grief group called Lemonade that we worked with the girls. We started a community garden. And we held a jamboree, which was sort of a welcome event to our buildings, a get to know you, invited people in. Our needs assessment that we completed gave us a lot of information. Again, what were the stressors of the neighborhood, what were difficulties, what were challenges, and how we could help support. A lot of the needs assessment we did just very casually, again, through community conversations. So we tried to bring people together, different neighborhood organizations, to ask them what they believed were the strengths and challenges. Again, we hosted a jamboree, which was sort of our first big event at our new space. We hosted a economic empowerment community conversation, and finished our first year having moved in. We moved in April, and that was the end of the first year of the grant. The second year of the grant, I will call responding, because a lot happened that year. So if you remember 2020, it was a year of a lot of things. So our task force was continuing to meet on a quarterly basis. We were continuing to offer BSB trainings. We were collaborating with a lot of partner organizations. We hosted an event with All About Women around domestic violence and healthy relationships with an art intervention for kids. We co-sponsored several outreach and healthcare access events. We worked a lot with the schools, continued relationships with Pearl-Cohn and other schools, continued our Lemonade group at Pearl-Cohn. We hosted teachers from Pearl-Cohn for an event here where it was just like a staff appreciation where we had lunch and gifts, and that was during the holidays. We hosted a clothing drive for Pearl-Cohn. We hosted the girls from Pearl-Cohn for an event that called Pearl-Cohn Girls Rock, and we did some ACEs work, we did some trauma work, we also did some resilience and empowerment work with the girls there. And that was in January 2020, and then the tornado happened, March the 3rd. And so then our work changed a lot into some tornado response work. And then, of course, we did COVID response work, and then we responded to the Black Lives Matter protests that were happening. And so a lot of our work sort of shifted during that time. But what was really great was that we were able to continue our work, but just in a different way. So this was an event before all of that happened, where we partnered with Davidson County Relative Caregiver Program, did sort of a back to school bash event. This was about the All About Women event that I told you about, focusing on healthy relationships. The Pearl-Cohn students coming over. And then, like I said, the tornado happened. And when the tornado happened, as we know, North Nashville was heavily affected by the tornado. So our staff just immediately hit the ground running. We have a 24-hour crisis line here, which helped us to determine a lot of supports that were needed. Because we had staff at Pearl-Cohn, we were able to see what students and families there needed. Our coordinator for this grant just sort of reached out to all of our partners within our network, which we have more than 60, who were telling us what are the needs on the ground, what are the things that we need. And so we immediately just started trying to respond as much as we could. We provided material assistance. We provided pet supplies to the National Humane Society for pets who were displaced. We started doing some art therapy with kids in North Nashville, again, with our partner My Canvas, around tornado response. We counseled as much as we could with our counseling program here. Many of our staff were just volunteering as many places as they could. We started providing emergency food and meals, and we also opened our building up to DHS staff and clients who had lost their space to the tornado downtown. So we tried to be the best partners in North Nashville that we were able to do during that time. These are some of the pictures that show how we were able to do some of that work. This is the My Canvas work that was happening. I'm going to tell you more about that in a little bit, but they started collecting debris from the tornado to turn that into an art project that I'll share a little bit more about. And then COVID, so a few weeks later, COVID hit. And so we had to cancel a lot of our in-person events. So remember, we had been in our building for a little less than a year at this point, and we're hoping to have all kinds of things all the time. And we had many, many more events planned. So we canceled those as sort of everybody went into a lockdown at that point. But our task force was still heavily engaged. We also switched at this point to a lot of online presence. So we created an online newsletter, we created a Resilient Police Task Force Facebook page. Later, we started doing some community chat. So we decided we were going to try to reach people as well as we could virtually during that point. We had a big event planned called Nashville Up Play, which was a partnership with this project and our relative caregiver program. It was where we were going to bring families in for a whole week at different activities each day. We had partners with the public library. We were going to do a lot of different types of work around art and reading and just kind of fun stuff. Things through all that, but we ended up having that virtually that week. And so it tells you a little bit about this: Music Monday, Artistic Tuesday, Wow Wednesday, Theater Thursday, Strong Foundations Friday, and Safety Saturday. We were able to just, again, do those on a virtual platform instead. And then there was the murder of George Floyd. Our agency immediately tried to shift to be responsive to systemic racism in our country. And so we started holding a lot of events, especially for our staff, around trauma processing and debriefing, and how our agency wanted to respond to this as well. And I'll tell you more about that too, because we did a mural project related to that. So then the next year, it was on strengthening and rebuilding. Some of that was virtual and also started to be in person again. So in year 3, we were hosting a lot of our things virtually at the beginning of the year. That year, we adopted a bus stop. We were continuing to engage partners. We started providing our ESP training virtually, and we continued to enroll people in healthcare. All of our services here continue, but they, looked a different way, and they had a different format. We had virtual support groups, virtual enrichments, things like that. So this is an example of the bus stop that we adopted, which is between us and Pearlton High School, right down the street. And then so I was telling you about the Rising Phoenix. Our staff helped kids in North Nashville collect debris. And then our art therapists helped lead them in activity where they created this Rising Phoenix, which is on the corner of Rosa Parks and it's right across from Cheatham Place. What is it? Yeah, Monroe. It's right across from Cheatham Place, and you can go see it. But we had an unveiling of that that year in June, where we had a big event and people came out and saw. So the kids were able to process the grief from the trauma through this. We also, that same day, we unveiled a mural project where we partnered with a local artist, and he led the kids through processing their feelings regarding George Floyd murder and the Black Lives Matter protest. And they created actually a mural, which is also over there around the corner just a little bit, on the wall of a restaurant called Local Bistro. So we partnered with them to create this mural. We had a lot of people come out, so sort of right when COVID numbers were a little bit lower and it's an outside event, we had probably more than 100 people there. And it was a beautiful event, and also very grateful to Local Bistro because not all businesses will let you put something like this on their business, and they were fantastic partners to work with. And so then we have year 4, which we've just finished. We started out the year partnering with ProCode and their Promising Scholars project. They wanted to do a community garden and they weren't able to. So instead, we helped them make pots, and then the students were able to plant in their individual pots and take those home with them. Another thing we did this past year was we worked with a couple of different other nonprofits that were called Eyes on Kids, and they were concerned about the stress that ECS employees were experiencing over this last year, and so wanted to create a safe place, a charging station for ECS employees to come and rest and relax and rejuvenate in between sessions and just whenever they needed a break. So in our building, we created this room that anyone can use. It's open to ECS employees first and foremost, but anyone is welcome. It's a place where we have snacks and drinks and music and magazines, and just a place that anyone can kind of come in and take a break. We also developed online community chats. So these were a way, again, to respond when we had less in-person events. These were happening weekly, where we, Shandell, and then another partner of ours, A Step Ahead, talked about a different organization or a partner organization happening in Nashville. And you are certainly welcome to check those out. They're on pause right now, but I think they're starting up again soon. And so what's next for us? This coming year, we're focusing on thriving. So we have a lot of different exciting things that we're working on. Shandell has some great ideas. And we are hoping to, we're having a back to school bash here July 30th. So we'll have vaccines available, we'll have backpacks available. We're doing this in collaboration with our healthcare access teams, enrolling people in insurance, and that kind of thing. So there's a lot to look forward to for this year. And I'm really hopeful that despite what happens in our world, that we can continue to be a place where people can process trauma, create resilience, and get to access the resources that they need. So, thank you.
Thank you, Emily. Thank you, Emily. We appreciate all the work that you guys are doing, and thank you for bringing us up to speed with that. As always, I hope that there's something that you heard Emily say that caught your attention, intrigues you, and that you would want to reach out and talk with her about. So the next folks that are going to come talk with us are folks from South Central Tennessee with the South Central Resiliency Project. That will be April Scott, who is the Infant and Early Childhood Program Manager at Centerstone. And I think she has some other folks that are with her. So April, if you want to start making your way down. South Central holds a special place in my heart because that is the second best part of the state. I'll let you figure out what the first best part is, but the second best part because I grew up there. So April,
Hello, everybody. So we started doing system of care work like around 2000, and then in 2011, we switched to collective impact efforts and really used that approach in our work. And then, as you know, the ACES knowledge mobilization teams rolled out. And when Sean Noblet temporarily left TCCY and our membership was down and our collective Impact Community Action Network, we decided in June of 2021 to form this South Central Residency Project, which is just really a collective impact group comprised of different partners, parents from the community, parents who graduated from programs, DCS, TCCY, Aligned Hope Consultant, and other members, and working together. And our goals are community education. And right now, that involves using healthy outcomes for positive experiences, or HOPE, and it's also infused with science of the positive. And we use that as a framework to promote positive childhood experiences. And really, we call promoting positive childhood experiences because we're really helping spread the message and give that uniform language that we can all use to communicate about positive childhood experiences and preventing and mitigating ACEs, and working on those 4 building blocks. We also have positive community norms, which is also part of Science of the Positive. And we've had some trainings and have some coming up. The next one is October 13th, and Kimberly Ladd with Aligned Hope is passing handouts around for that. You can come in person and grab lunch as long as COVID cases stay down in Columbia, or you can join virtually. So my email's on there if you want to email me for more information about that. Our vision was really in response to the latest science on adverse childhood experiences to grow upstream wellness by cultivating healthy outcomes from positive experiences through collective impact and community engagement. Our second goal that we're working on right now is equitable promotion of protective factors to increase positive childhood experiences with family-centered approaches. One example of that is our work. We're currently working on developing a parent-led work group that will fall under the umbrella of the South Central Residency Project. And we're also partnering with the National Hope Council, who is also simultaneously working on a national council that will include parents with lived experience and community members. And in addition to that, Jasmine Journey, many of you may know her formerly at Centerstone, but she is now with Tennessee Department of Health, and she is charged with creating that parent-led council for Tennessee. So we're already in talks with how we can partner with Tennessee Department of Health so that Centerstone's South Central Residency Project, Tennessee Department of Health, and HOPE can all work together to make the most of the resources that we have. I don't think I mentioned, we don't really have any funding tied to this project. It just so happens that Centerstone has a myriad of grants that are all working to prevent, mitigate ACEs through multi-generational approaches, and some funding for collective impact. So we've just kind of piecemealed it all together and are working together to roll out action steps for our project. Another goal that we have is increasing equitable access to services and informal supports that promote positive childhood experiences. And you'll pretty much hear the word equitable or equity in everything we do. We formerly had a racial and ethnic equity action team as part of our collective impact work. But again, when COVID hit and we stopped having our face-to-face meetings with all those great lunches and feel-goods when people were coming together, we kind of lost a lot of our community membership. So we're really working to rebuild that now and still offering hybrid options for people to participate and join in the activities. Some of our upcoming work that we have going on is we're partnering with Carla Walker at the South Central Commission for TCCY, and we're providing a HOPE 101 training, and that's August 23rd from 10 to 1 p.m. Central Time. And I believe Carla is finalizing the handout on that to distribute out in the community. And just because we have South Central in there doesn't mean that other people from other parts of Tennessee can't join us. So we'll be sending that out, and we hope that any of you that want more information about the HOPE framework will join us for that, to get that information. And then positive community norms, which I already mentioned, Kimberly Ladd has those handouts out. And our next meeting for the South Central Residency Project is August 9th, 9 to 10 Central, and it will be virtual. Does anybody have any questions about the things that we're working on right now? Thank you, guys.
Thank you, April. Thank you all so much for going along today with us and navigating our technical challenges. One of the things that's really important for us at any meeting that we host is to really provide folks to make any kind of announcements or share any kind of information or updates that they have. I think that our dear friend Janet Watkins with the Department of Education may be online. So Janet, if you're there, we would welcome you to provide any kind of updates. While you're thinking about that, I will ask Carrie Virgo from the Tennessee Department of Mental Health and Substance Abuse Services to join me. She has a pretty exciting announcement, and I want to give her the space to be able to do that.
Thank you, Richard. I actually have a few now that I was sitting there thinking about it. It's conference season. I don't know if y'all have federal grants, but it's carryover time, so we have conferences. So I've got a couple conferences that are coming up. The Early Psychosis and Clinical High Risk Psychosis Conference is coming up on August 30th and 31st. That will be a hybrid. They'll be doing some in-person as well as virtual. In addition to that, if you have any young folks, young adults that are interested in being part of our Peer Leadership Academy, we are having an academy here in Nashville on August 22nd. And Melissa, I'm just going to put it out there that if they have questions about this, they can contact you and you'll get that to you. So I am happy to announce that with the Young Adult Leadership Council. In addition to that, we have started last year the Certified Young Adult Peer Support Specialist Program that got off and launched last May. And so we are now certifying young adults to provide peer services to other young adults. And we currently have 8 certified young adults in the state. So we're really excited. So if you know of anybody who's wanting to use their lived experience to help others, we would love to talk to them. And then the last announcement I have is for those of you who have ever attended a System of Care conference, it kind of went a little by the wayside over the COVID time, but we are coming back and we are going to host a children's mental health conference on September 27th and 28th, and that will be here in Nashville at the Sonesta Hotel.
Thank you, Carrie. Always good and exciting things happening out of the department. For those of you that are joining us virtually, if there are any announcements that you have, if you would put them in the chat box, folks that are smarter than I will be able to get to those. But again, want to open up to the room if anyone has any announcements for the good of the group. Janet is on.
She is, she's right there.
Hey, Janet, you're right behind me. So I don't know why I turned around. I'm gonna wave at you here. So I'm going to let Melissa figure out how to make sure that we can hear you.
You can start talking, Janet.
Okay, well,
Oh,
thank
that's
you,
not it.
Richard, and can you hear me?
Not yet, Janet.
Thank you, Richard and Melissa. We
Like your
continue to, can you hear me now? Okay.
Can't hear you. Hold on just a second.
Okay.
I don't know if I'm smart enough to know why.
Hey, Janet. You know what? I bet she could call me. We could just put the microphone.
That's true.
Hey, Janet, you want to call me on my cell phone?
Or I can put it in the chat.
I'm sorry, Janet. We can't hear you. That's so sad.
Does she have the phone? What's she saying? You know, we started out with tech problems. Let's wrap it
That's
up.
okay. I'll put it in the
So
chat.
as we're figuring out how to hear some updates from Janet, anyone in the room?
I did have a question from someone online about an age requirement for the peer leader, the certified young adult peer support specialist. Jerry's the smartest. What was the answer? Maybe we want to know. 18 to 30. Thank you.
Oh, I know.
Jane, Melissa thinks she has a solution.
Talk to us.
Hello, can you hear me?
Yes.
Wonderful. Well, thank you all for asking what we are doing. We are actually continuing to support our 176 schools in our second cohort of trauma-informed schools. We just completed yesterday and for the last 2 weeks, our second training for them called 6 Pillars of a Trauma-Informed School, in which we go take a deeper dive into all of the strategies behind the brain science. What do we do once we know all of that? So what are the deeper strategies that schools can hook onto and delve into? So we just completed that along with all of our community of practice calls that we continue to have with our schools. So our first project, we had 73 schools. This project, we had 176.
Thank you. Thank you, Janet. We appreciate you sharing that information. You guys are doing really good work at the Department of Education, and we always love to hear the updates from you. So thank you. All right. Anyone else? Any other announcements on the chat?
You guys stop wondering.
Sorry, Tracy.
We did have one announcement. The Tennessee Voices Survivor Connection Program is a free program for individuals of all ages. We serve victims of crime across every county in Tennessee. Anyone can make a referral on the TN Voices website, which I believe is tnvoices.org, or you can email ashley.arnold@tnvoices.org. I think that's the only thing I see.
All right. Thank you all. So as we wrap up a little bit early today, again, I really want to thank you all for your grace as we navigated way too many unforeseen technology challenges. I hope that for those of you that joined us virtually, it was beneficial and smooth for you. For those of you in the room, I hope that you were still able to get some useful information. So as we wrap up, what I do want to remind you, you've heard me say numerous times, is there are a couple of things that are coming down the pipe. So one, you're going to get information about joining our virtual meeting of the affinity groups. We really want to, like I said, start that work, and sooner the better with that. Please know that we are committed to working with Melissa Newman as much as possible within our resources to learn as much as possible about collective impact and to be able to support you as you do the work in your communities across the state. Please know that with this group, with the Resilient Tennessee Collaborative, our goal is for this group to meet quarterly. So if you are doing and or know of something really interesting happening in your part of the state that you would like to present to the larger group, certainly reach out to Melissa and we will work to have you on the agenda. As always, as you're doing this work, if there are things that you're like, I need to know more about X, or I'm having a Y problem, certainly let us know, and we will utilize the resources and relationships that we have to be able to get information to share with you and help you be as successful as possible. So as we started today with setting our intentions for what we hope to accomplish, I hope that you were able to fulfill that. So as we wrap up, I would kind of like for you to take about 10 seconds, just kind of think, what did you hear today that intrigued you? What do you want to learn more about? Or what is it that you know for certain that you do when you read this? All right. So the last thing, as you walk out, my only other hope is that you would shake hands with someone that you haven't met, and if there's someone that you want to connect with, please know that you have the time and the space to do that. So thank you all so much. I think that we're off to a good start with this Resilient Tennessee Collaborative and look forward to what we're going to be able to accomplish to make life better for children, youth, and families. Thank you.
Thanks, friends. Thanks. Sorry.
I guess I just.